The American College of Physicians wants to do more than pay lip service to the concept of the patient-centered medical home. At its annual meeting in San Francisco, the college announced creation of a new Center for Patient Partnership in Healthcare to foster closer collaboration between physicians and patients.
We have recognized that to truly be able to move the needle for healthcare, we as a physician organization cannot be working alone. We really need to be working with patients and with patient organizations. We can very much say from the physician's point of view what we think patients need, what we think patients want, but that's not really the right vantage point. The right vantage point is for us to be working with patients in a partnership. And I'm actually a medical educator by background. And one of the things that I've certainly learned over time is that I can provide the best education not by saying what I think people should learn, but by getting a sense of what they feel they need to learn and what they want to learn. And the same is true, I think, for our resources that we produce for patients. And what we've done at ACP is we have decided to establish a new center, which we are calling the Center for Patient Partnership in Healthcare. And I think that that really embodies what we want to do. We view a lot of the things that we will be producing on the educational front, both for physicians and for patients, as being a partnership, and in fact need to be done as a partnership. The materials and the resources that we provide for physicians need to take the patient's voice into it, and similarly the materials that we provide for patients and the resources for patients need to take into account not only the medical and the clinical issues, but the patient's viewpoint. So one of the things that we are doing at the college now is to work very closely with patient organizations. And we want the patient materials and resources that we provide to be truly patient-centered. And that's patient-centered at both a macro and a micro level. The macro level is how we deliver care that's patient-centered. The micro level is how the individual physician and patient interaction can work best, taking the patient's needs and preferences into account. And I think it also means that we need to be able to customize our care for individual patients, recognizing things such as their health literacy level, their interest in being involved in their own care, how much they are interested in being involved in their own care, all of those sorts of things. So this really represents, I think, a paradigm shift for how we are approaching the kinds of things that we need to do at ACP to be improving healthcare for our patients. So what I mean by that is as practices redesign to be more patient-centered, so-called patient-centered medical home, we want to be sure that we're getting the patient's voice into how those practices should be redesigned. How should they be transformed?
I would add that we really want to begin translating the term patient-centered to really include the patient in the design and structure of the future of healthcare.
Reporting for IMNG Medical Media, I'm Sherry Bosher.